Hello and welcome back to our live event once again. It's time for our online patient meeting. I am your host, Caroline, as always, and I'm happy to be here again with Dr. Anna. Hi, Dr. Anna. You can hear me well, I hope.
Yes, perfectly, Caroline. Thanks.
Perfect. Thank you so much for just confirming that. And please let us know that you can hear us, and so we will be able to go ahead with all the details. But I just want to remind everyone that this is our second live event with Dr. Anna. So I'm glad that you are back with us. So thanks for that already. And tonight we have another interesting topic to discuss. And of course, all those Stronger Together events are brought to you with a huge help from our partners and ambassadors. And as always, I would like for you to see them right here on the screen. Without them, it's not possible to go ahead with any of those events. So huge thanks for them for supporting our initiative, as well as our top experts, of course. And tonight another top expert is with us, and this is Dr. Ana Galindo Reyes from Gravida, which is located in Barcelona. She's the medical director, and she will today talk about techniques derived from donation of gametes, embryo adoption, and ROPA methods. So she will be able to start off with her short introduction. Later on, we will go for the most common questions, and after that, we will simply go ahead with your questions. So don't forget to type those in the chat section, and Dr. Anna will simply answer them for you. So any questions you have, and I'm sure you do, go ahead and type it in. And thank you so much for confirming you can hear me. And I guess we can start off with the introduction. Dr. Anna, are you ready?
Ready.
Perfect. So let's go ahead
Oh.
with your presentation first and introduction.
Okay.
Thank you.
Okay. First of all, thank you, Caroline. Thank you to Stronger Together to give me the second opportunity. As you see, I'm different from the picture that you saw at the beginning because we started our clinical practice again. And due to COVID-19, we introduced a few new items in our look. So this cover of the hair is just safety measures, not to be touching our hair and touching other thing and trying to be not to be vectors. So sorry about all this different look. I'm going to start about our subject this afternoon, which is little techniques that are started appearing since we started the egg donation, which is the embryo adoption and the ROPA. First, I'm going to tell you a few things about the embryo adoption. The embryo adoption came out of our legal framework. We have in Spain this law that give us the opportunity of using the extra embryos, the supernumerary embryos that are not used in the IVF cycles when the patients have completed their families and they don't want to use these embryos for themselves, to give these embryos other uses or simply not give any use. So when a frozen embryo is created, afterwards it has these legal uses that you see here, use for your own use. And in this case, in case of embryo adoption, are families that have already completed their project and they don't want to use it for themselves anymore. The other option is donating for reproductive purposes. This is the subject that these families, that they, of course, they want to do it, and they ask for giving these embryos for reproductive use to help other families to start building up. The other option is donation for research, and the other option is just throwing them with no use. So out of this frame of the law, it came all these programs in our centers and all the centers in Spain that have these few embryos, because it's not that common that the couples or the patients give their embryos for adoption. But we have these programs that use these embryos or offer these embryos to be adopted by other patients or couples. So, what are the requirements for these embryos to be adopted? First of all, this donation is voluntary, anonymous, and altruistic by these families or couples that give the embryos in adoption or for reproductive purposes. And these requirements stay in the frame of egg donation or gamete donation. So for the egg, the age of the egg has to be, of these embryos that generated these embryos, has to be 18 to 35. And we have to go again and review all the familiar and personal risk factors for these two parts, the egg and the sperm. We need to know that they are in good health, mental health, absence of sexual transmitted diseases. We usually do it when we perform our cycle, so all the embryos are tested for this. And also karyotype, this genetic testing, that it's the key point, I guess, because karyotype, most of patients have already done the karyotype, so we have it normal. Of course, out of this group of embryos, there's embryos that gave birth, and these kids have to be healthy for the extra embryos to be donated as adopted embryos, of course. And the genetic testing is the key point, because what's the ideal genetic testing? Every center has their own parameters for security, genetical security. We use the parameters that we usually accept for egg donors. So if they don't have all the tests that we perform in egg donors, we ask the patient or the couple to come back to the clinic and redo this genetical testing, meaning carrier map and all the items that we use for donation. And of course, the number of offspring out of this couple or these specific gametes has to be limited to 6, because this is our law frame. So these are the requirements, basically. What are the assignation criteria? Of course, we have to minimize pregnancy risk. So the patient that is adopting these embryos has to be healthy uterus, normal uterus, or at least capable to carry a pregnancy to the end. Of course, we match out of a basis of phenotype. It's not a detailed phenotype because these embryos are already created. So these embryos we know the race or the physical characteristics of the two gametes, and according to that, we try to match a gross match with the patient who receives these embryos. And we usually assign 1. Sometimes we get to 2, but in reproductive medicine, we tend to decrease the number of embryos that we transfer, because we don't want the risk of a twin pregnancy. So usually what's recommended is to adopt 1 embryo at a time, 1 embryo per transfer. This is according to embryo adoption. These are the generalities of embryo adoption. Later on, we can talk about details that you are interested on. And let's talk about general issues about ROPA. ROPA is a technique that is specifically designed for building family for lesbian couples. same-sex couple, feminine, in which we have 2 ovaries each, 1 uterus each. So we have this advantage that we can have more options in terms of pregnancy. The classical options for these couples were the intrauterine insemination with donor sperm, or the in vitro fertilization with donor sperms, meaning the patient, the mother that stimulates her ovaries is the one that receives these embryos fertilized with donor sperm. But another option appeared in the frame of the law in Spain that tries to make equal or try to treat equally the heterosexual couples with homosexual couples. So it means that if in an heterosexual couple, the male can give the sperm to the female to fertilize these eggs and create a family together with IVF, in two women couples, in lesbian couples, these rights should be the same. So one of the partners should be able to give her eggs to the other partner for her to carry the pregnancy. So both can share this motherhood. One is giving the eggs and the other mother is carrying the pregnancy. That's the idea of ROPA. ROPA stands for receiving oocytes from your partner. Also in Spanish, recibiendo óvulos de tu pareja. So it means that you, in terms of couple being together to build a family, one can give the eggs to the other one to carry. This is a technique that requires IVF treatment. It means that one of the partners is going to be the donor, is going to stimulate her ovaries in the same frame of an IVF treatment. And these eggs are going to be inseminated with donor sperm, and these embryos are going to be transferred to the other partner, which can be getting ready at the same time. So what we call synchronical ROPA. It means one of them stimulates the ovaries, the other one at the same time prepares her endometrium to receive these embryos in fresh cycle, or can be asynchronical. This means first one of the partners stimulates the ovaries and creates these embryos. These embryos are frozen, and then later on, the partner, even with a natural cycle, gets ready to receive these embryos. So this is a technique that our law is pretty flexible about, and we've been doing this technique for a few years already, and it works pretty well. It's another concept that before, right, maybe 10 years ago, the idea of the lesbian couples that came to the clinic was an insemination, maybe an IVF, but later on, maybe around half of couples ask about ROPA and think seriously about it. So it's one more option that can create another diverse family in this diversity of socially diverse families that we have. So these are the general terms of ROPA. I don't want to extend myself too much, so you can ask your questions or your doubts about these two techniques. So thanks a lot, and if you want, we can start with the questions.
Okay, perfect. Thank you so much for your explanation and providing those details. And of course, right now we will have even more information as we will start with our most common questions. And right after that, we will go with your questions. So don't forget to type them in the chat section. And first, we will start with embryo donation. So the first question is, What's the difference between an embryo donation and double donation?
Yeah, it's a good question, because essentially it's the same, because the embryo comes from a donated egg and a sperm, donated sperm. But the difference is these embryos that are donated come from a group of embryos that were already created in the past, and out of this group of embryos, the main one has been transferred already. So these are the remaining embryos when these couples or patients have gone through a few transfers. Usually they have 2 kids, maybe 1, maybe 3, and they have remaining embryos frozen, but they are not the first one that we would choose. These ones have done their kids, but have become their kids, but they're not bad embryos. They're good quality embryos, but out of this group, some have been used already. Of course, that's one difference. The other group, the double donation, is we create a group of embryos for the patient or for the couple. So all the group of embryos are for this patient. The ones that we would choose first, the ones that we wouldn't choose, but they're good embryos, so we freeze them. So these embryos, the double donation has a slight better pregnancy rate compared with the embryo donation because of these characteristics. There's not bad. Around in double donation, we have around 58% chance of pregnancy or implantation rate. In embryo donation, we go for 45, 48, sometimes 50% implantation rate. So it's a little lower, this implantation rate, because they are not bad embryos, but they are coming from a group that has already given birth to the ones that we chose in first place. On the other hand, the physical characteristics are more accurate when we create these embryos for a couple or a patient, when we take in account color of skin, characteristics of the face, height, weight of the recipient, to match better this phenotype compared with these embryos that have already been created. So the general match is more like general in terms of general characteristics, color of skin, color of eyes, but sometimes it doesn't match. It's like if I wanted to receive or adopt an embryo, it might be an embryo that coming from an egg that is lighter than me, or maybe a sperm that is darker than me, or not meaning maybe very different, but slight differences that wouldn't happen in double donation. So the concept is different, and the results that you can expect out of these embryos are little different. The thing that it's same in our clinic is that the tests that we require to donate the embryos or for an egg or sperm donation are the same. In this study part, they are equal.
Okay, excellent. Thank you so much for answering that question. And now it's definitely more clearer. I know sometimes it's a bit confusing, but thank you so much for explaining this now. And next one is right here. What can I know about the donors of an adopted embryo?
Okay, this is a good question too. In Spain, the law says that a donation has to be unknown, has to be anonymous, except for these cases like ROPA, that it's a couple, that it's the only legal exception for this anonymous fact of donation in Spain. ROPA is because we make equivalent the heterosexual couple with homosexual couple. But in terms of embryo donation, adopted embryos, the anonymity is still there. So what we can know about it? We can know the age of the egg, because the age of the egg will mark during the pregnancy. If we have to go through some tests, the age of the egg is important as a marker for risk of Down syndrome and other little markers that could be important for the obstetrician that follows up the patient. So of course the age can be known. If they want to know the age of the sperm, also they can know this. And general characteristics of the donors, meaning color of skin, color of eyes, color of hair, and general height and weight, complexion of the donors. This they can know. And also they have the certificate of all these tests that we performed in the donors, so everything matches with the frame of egg donation and sperm donation.
Okay, perfect. Thank you so much for answering this question. And there's another question here. So what's the average waiting time for donated embryos?
Oh, well, this depends, because in our clinic at least, the the embryos keep coming little by little. So there's maybe some months that we have a lot of embryos coming in, meaning that the couples that have these embryos already signed this consent that they want to give the embryos. We tested the partners, everything. And there's some months that we have just a few. So depend. It could go from nothing to 2 months or 3 months at the most. We don't usually have more than this. Of course, depends on the phenotype of the patient and the partner. If it's Mediterranean type, like me, most of our patients are this type. So it wouldn't be a problem. If it's another phenotype, like Asian phenotype, or other phenotypes that are more unusual in our area, this probably would represent a little more waiting time. So depends on the entrance and on the demand of these embryos.
Okay, excellent. Thank you again for that. And the question is here, so how does the pregnancy rate for adopted embryos compare with double donation, which are embryos created specifically for the patient?
Well, as I said, there's a slight difference between the adopted embryos and the embryos created for the patient, because of this concept that ones are the supernumerary embryos and the other ones are created specifically for the patient. So in terms of the group of embryos, this percentage differ around 10% difference. This is what they usually. That also depends on the stage when they were frozen. The day 3 embryos that are the oldest one, that we barely have this type of embryos, because we do a lot of blastocyst stage. So the most of the embryos that are given in adoption right now are day 5 embryos. They have they pass through more tests, they gave us more information about themselves. So there are embryos that have a little more implantation rate. Day 3 are less tested. They could be good embryos, but it's not quite the same. So it depends on the stage of freezing, depends on many factors that could be a little different between both.
Okay, thank you again for answering this and providing the details. Now we will move on to the questions about ROPA method. So if you could take a look at the question here. So is ROPA viable treatment for all lesbian couples?
Well, it's a treatment that we can talk about in most of couples. Of course, the pregnancy rate that we are, or the pregnancy rate that we are expecting out of this treatment depends very much of the age of both members of the couple. Meaning, if both moms are over 40, the rendability of these treatments will be lower because of this ovarian aging. Depends on the ovarian reserve, depends on which mom wants to be the donor, which one wants to be the carrier, because sometimes we have interviews with the couples, and well, one of them, which is maybe 32, wants to be the carrier, and the one who is 42 wants to be the donor. And in this case, is quite difficult because the eggs are going to have less pregnancy rate expected, compared with the other way around. But sometimes they have the very clear the idea they want for their families. So it's we can plan ROPA in any case, depending on the age, depending on the circumstances, is more rendable, the rendability is higher or lower, but it's viable for most of couples.
Okay, excellent. Thank you so much again for answering that question. And how about, so are there any legal limitations for lesbian couples?
In terms of ROPA, the interpretation of the law is very tricky sometimes, because ROPA is the only exception for anonymity in donation of gametes. So it's kind of tricky and depends on the areas of Spain. Specifically in Catalonia and in Barcelona, we have a local regulation where couples are considered couples if they can demonstrate, or they with minimum demonstration that they live together, or they just say they are together, they are considered pact. In other areas of Spain, they have to be married to be considered a couple. So this legality depends on the area where we are. Even we are all in the same law frame, the local regulations are slightly different. Here in Catalonia, they don't have to be married specifically to go through ROPA, but they have to be couple. You can't come with your neighbor and tell, theoretically, and say, okay, because they both have the rights of maternity. So when you go for a ROPA, it doesn't mean you donate me your eggs. It means I'm going to be mom with you. So the rights of the donor, the rights of the recipient are the same. They are legally mothers of this kid, which is not the idea of an egg donation. The egg donation, the donor gives cells, and the mothers or mother and father are others, the ones that go for treatment. In ROPA, it's not this concept. It's both moms are going to go together through this treatment. So it's the concept is different.
Okay, thank you so much for answering and explaining this to us once again. This is definitely important to know that the law can be quite different when it comes to different parts of Spain. Yeah, definitely. something to remember for sure. Thank you so much. Okay, and so within ROPA, the donor mother gives the baby the genetic information. What does the recipient mother give to the baby?
That's a good question too. We know that the individual, as we know ourselves, are a mix between genetics and environment. And what does this mean? In the cells to express themselves, all the cells of the body, we come from one cell that it's the result of the combination of the egg and the sperm. This cell is going to give the full genetical information to these cells that come from the first one. So all the cells in our body are going to have the same genetical information, but the genes that are expressed out of every cell depends on many environmental things. This means that the final individual is going to be a mix between what the genetical issue says, this book that is written in the cell that says how the individual should be, more or less, but the environment reads this book and can read this book, skipping one chapter, reading more intensively another chapter. But if this same cell would be in another mother, this would be the chapter that the other one skipped, would be the intense reading, and the other chapter would be just avoided. So depending on the environment where this cell is developing, and meaning the embryo is developing, these genes that are going to be expressed can be a little different, this expression, meaning that we have the same book written, but the reading can be different. This means that the final individual will have this expression of the genes depending on the mother. And what this can be, well, sometimes is little physical characteristics that can tend to the mother that carries the pregnancy. Sometimes can be risk factors for some sicknesses that turn on or off depending on the environment of the uterus. Many things are modulated by the intrauterine environment. So both mother that gives genetics and the mother who carries the pregnancy are going to give this kid final inputs.
Perfect. Thank you so much once again for clarifying this to us. Now it is our last question when it comes to those most common ones, and then we will go for your questions. So go ahead and prepare them so that Dr. Anna can answer them for you. And the question is, what happens with the remaining embryos belonging to both partners but genetically related to one if the couple breaks apart?
Well, this is an interesting question, because if a couple, as I said, when a couple goes through a ROPA, it means that both mothers legally are mothers of this baby, so the future baby. So meaning if the baby is born, both are going to have the same rights with the baby. But also with the embryos, they both went through treatment together. So these embryos are earned by both. So if the couple splits or breaks apart, these embryos can't be used except for the situation in that both ex-partner agree to sign consent to go for treatment and also be legal mothers again for this kid. So we need the consent of both mothers, even though one is the genetically related and the other one haven't gone through the transfer. But the legal idea of these two mothers is the same. They both have the same rights on these embryos, independently of the genetics.
Okay, perfect. Thank you so much for answering all those questions. Okay, and now it is time for your questions. So, Dr. Anna, thank you so much. And are you ready for some more questions from the patients?
Ready.
Perfect.
Let's go.
Happy to hear that. So here's the first question that we have. It's there are two parts of it. Okay.
Mm-hmm.
So it's like the law is not applied equally in Spanish clinics. Some clinics will only give age and blood group, whereas others will give more non-ID information. My children are 13 and want more than age and blood group, but my clinic have consistently refused this. Anything you can add to this?
Yeah, that's completely right. The law says it has to be anonymous. What our concept of anonymous depends of each clinic interpretation of the law. Unfortunately, there's no basic guidelines on what we should communicate about the gametes to the recipients. So there's some clinics that are more open about it. Some clinics are more restrictive because depending on, well, if there was, we usually have many inspections from the sanity, and depending the person who comes can decide that we do is too restrictive or too open. So we are kind of a little tight in these subjects. In our clinic, what we do, we inform about general phenotypic characteristics, age, and blood group. That's what we inform. Other clinics only inform about age and blood group. They are more restrictive. And you are completely right. The law is not applied same way because the law is very generic. It says it has to be anonymous, but what's considered anonymous? Who knows?
Okay, thank you so much for clarifying that. Definitely, anyone needs to consider that because I guess when you are choosing a clinic, for some patients this is kind of important. So this is something that I guess every patient should be asking: what kind of option? What kind of information do I get from this specific clinic? Yeah.
And also important is also ask about what are the security tests that you are meaning genetical security, what am I covering having this sperm or eggs donated and what I'm not, and I have to be aware what are the sicknesses that are being tested, what are the ones that are not, and information is very important, and having a report on these tests that we perform is important, is the right of the patient.
Okay, thank you again for clarifying this. And there's actually a follow-up question, so let me go through it again, just because it's just on the topic. Can you find out about the educational level and hobbies of the donors of donated embryos?
That's a key question. We don't really give this educational information because we have this feeling that, as I said, the individuals are genetics, are environmental issues, and sometimes, and I've been working, and I'll be really sincere in this, I've been working for 20 years in egg donation, and there's two main profiles of donors. There's the donors that are at least in our clinic, main profiles. The donor, which is the university student, and they want to get some money for traveling or something. They knew that they can help, they are young, and they come to the clinic to donate. And there's the other profile, which is the person who works maybe in a supermarket, and they haven't had the opportunities of the university student, and they are young, they had their kids very young, and they are not going to use their eggs anymore. They know that they can help, and they say, well, why not? If I had to compare these students with this supermarket attendant, sometimes these supermarket attendants are survivors of society. They're really smart, but they didn't have these opportunities. And sometimes we have social issues about it. When you ask about how do you imagine your donor, you don't imagine your donor maybe with tattoos. Tattoos are not genetically defined. Maybe you imagine this violin player who's in university, very smart, but this barely matches with reality. Sometimes these university students are average IQs that they had this opportunity to develop. So we are testing or trying to give is not to set, not to try to define the donors or the only because of their capacity of education or their story. We don't want to select these donors in super first class donors and whatever the rest is. So because of these kind of issues, social issues, we don't really give hobbies or education, because hobbies and education are more environmental. Of course, there's a genetical basis, but there's a lot of epigenetics going on in here. And what we want to give is an equal right for all the eggs.
All right, excellent. Thank you so much for providing so many details. And this is true that definitely it should be considered. So thank you so much again for that. Next question is here. So I'm single. Is embryo donation allowed? Also, how long is waiting time for white ethnicity?
Well, in fact, single patients or monoparental families are the ones that mostly ask for embryo adoption, meaning I'm single, my ex, maybe I'm a little older, I tried several techniques, it didn't go through, and I want, as far as I have to take an egg from a donor and a sperm from a donor, I might get an embryo. As a concept is I'm helping these embryos not to be lost in these tanks forever, and also is more economically, it's easier economically because it's cheaper in terms of economics. And in concept, many monoparental families start with an embryo donation. So of course it's allowed. It's the most common type of embryo donation that we have. How long is the waiting? Depending on the embryos that are given. Usually for white ethnicity, it's not as long. What we have is between almost nothing to 3 months. For other ethnicities are longer because they are less common in our area.
All right, perfect. Thank you so much. But you do have some, if someone is in need of, for example, African ethnicity or Asian, so it is possible. It just takes longer, as I understand.
Takes longer.
Okay.
For African ethnicity, we have longer waiting. For Asian, it's a longer waiting list because it's cultural also. Mediterranean and are more likely, the culture is more like non-related to genetics. They better like to help. They don't want to destroy their embryos. Compared with other societies that are more like, I don't want my genetics to spread over the world without my control. So this happens a little bit with Asian Asian culture, and a little more compared with Mediterranean, with African cultures. Or, well, there's also patients that are living in Europe, but they're coming from other cultures. So little by little, Asians that live here and other ethnicities that live around here, they take the culture here, but not quite yet.
Okay, understood. Thank you so much again for that. And next question is right here. So we can choose between my partner and me for ROPA method. Who offers all sites and who receives them?
Yes, you can. You can. Usually, what we do, there's some couples that they have really defined what they want to do. Which one is going to be the donors, which one is going to be the recipient. Sometimes it's not as specified, as defined, and sometimes we've built families of all kinds. We've built families, meaning we want to share our motherhood. We have many families that one of the partners gives the eggs to the other mother, and they have a kid out of this. And then for the second kid is the all the way around. So the one who was the carrier gives the eggs to the other mother. So in concept, they share both genetics and epigenetics for all of their kids. There's other couples when there's this age distancing and one is younger, the other one is older. What we recommend is the younger one gives the eggs for the older to carry the pregnancy. And sometimes if we can't do the all the way around, sometimes these same embryos in the context of the couple can be transferred also to the one that gave in a second time, in a second baby. So all the combinations and all the structures or the combinations of family, in this case, we've done it and can be planned. The limitations are the medical issues that partners can have, the patients, both mothers, and the age, of course, and the ovarian reserve. So all the security issues should sometimes give us more like the information to change the way of the ROPA.
Perfect. Thank you once again for all those details. Definitely, it's good to know. So there are options, but you are always checking, who is like, let's say, it's about the, let's say, AMH level, as you mentioned. Yeah. So this is something you always check, and that way it's possible to, let's say, recommend even to the to both mothers what's is the best option for them. Yeah. Okay.
Yeah. The
Perfect.
ovarian
Thank
reserve,
you.
and also medical issues,
Of course.
diabetes, high blood pressure, if there's any malformation of the uterus, something that would give us the information to give the advice to turn the way
Yes.
of the ROPA.
To change it anyhow. Okay, perfect. Thank you so much for that. Okay, there's a next question. To be considered for embryo adoption, therefore to receive an egg, there is an age limit for the receiver.
Well, that's a good question. So the risks of receiving any gamete or an embryo are related to the age of the mother that is going to carry and all the medical sicknesses that could be concomitant to this person. Also, because of the fact of a given gamete external, there's a risk, a little increase of the risk itself because of the technique of the what's called the preeclampsia, which is the high blood pressure at the end of the pregnancy, because of some immunological issues that we are still far to understand. But it's low, and usually it's not that severe. Some cases are, but it's a little increase of this risk. But apart from this risk of preeclampsia, the chance of pregnancy depends on the age of the egg of the embryo or that generated this embryo. The limitations are more the age. So in Spain, the law says we can't transfer embryos over the age that we consider adequate. This is very, whoa, like, wow. And every center makes their own interpretation. We make the interpretation of the law according to what we consider that would be the maximum age that we would accept, that the risk of a pregnancy related to this age, because with aging comes the diabetes, the high blood, the overweight, etc., etc. So we have to just decide an age over which one we wouldn't transfer an embryo. In our center is 50, which is the main physiological age for menopause. In some centers, it's 55 in Spain. In most of centers in Barcelona is 50, but some of them accept to 55.
All right, perfect. Thank you once again for clarifying this. And it seems that this is now our last question. However, if you have any left, go ahead and type this in, as we will be finishing shortly. And the question is right here: how many embryos can be donated from the same couple?
Well, a couple can give the many can give in donation the whole quantity of embryos that they have remaining frozen. The problem with this is that we usually don't have that many embryos remaining. The supernumerary embryos, especially when we talk about day 5 embryos, are not that many. If we think of the standard couple that gives the patient, or the standard patient that gives their embryos, is the patient that already consumed some of the embryos, or used some of the embryos to build their families. So usually these groups are 1 to 3 embryos at the most. But the patients that want to donate these embryos can give in donation as many embryos as they have.
Okay, perfect. Thank you so much once again. And let's let me have a look at. It seems that that was our last questions. I don't see any more questions, but of course, I would like to remind everyone that if you would like to get some more details or any, or just simply some more medical advice as well, all you need to do is just to click on this link, and you will be able to ask your questions, and it will be simply sent to Dr. Anna and her team, and I'm sure they will be able and will be happy to help you out as well. Thank you so much, Dr. Anna, for joining our Stronger Together event tonight as well. This is your second one, so we are happy to have you back here. And there is already one of the comments right here. Thank you so much for answering my question. There are more thank yous coming right here. So huge thanks for answering and helping out a bit, of course. And to all of you, thank you for joining as well, and well for all of your questions. Dr. Anna, is there anything you would like to add?
Well, just tell you thank you, Caroline. Thank you, everybody, for being here at this time today. And just wish you a lot of luck, because many of you probably are looking for information and new options, and telling you that be positive and try to choose your best way to build your family. So thank you very much.
Perfect. Thank you once again for that. And let me just remind everyone that this has been recorded, so you will still have a chance to rewatch it within the next few days. It will be uploaded on our website, myivfanswers.com. And of course, so if you would like to get a notification when the new video is uploaded, all you need to do is just simply subscribe to our YouTube channel and you will receive that information. And there are more and more of those events coming up. So hope to see you tonight at 8 p.m. UK time. As you know, we will have another topic, and with us tonight will be Andrea Trigo. Some of you probably already know her, so I encourage you to join us as well. Dr. Anna, huge thanks so much once again. Have a lovely evening. Get some rest. I know you have the very busy day, so have a relaxing evening at least. And well, I hope we will be able to simply do it again. Thanks and bye.
Bye. Thank you.
Bye.